The Northern Territory is a large space. We have quite a big population of Indigenous people, non-Indigenous. They're spread sparsely throughout this territory, and where we're located in Darwin at the Menzies School of Health, we're on Larrakia country. Doing research up here can be quite difficult because we're quite isolated in distance, but also in the amount of other institutes that we have to connect to. My name's Mark Mayo. I'm the Melioidosis Project Manager and Senior Researcher at the Menzies School of Health Research.
We have a chronic biomedical workforce shortage, and the workforce that we do have, much of it is transitory, and we're not able to fill the gap with local skilled workers. This is an opportunity to build a local biomedical workforce that is going to stay in the Territory, that is going to be able to work locally. I'm Associate Professor Heidi Smith-Vaughan, and I head Health Lab and the Child Health Laboratory team at Menzies School of Health Research in Darwin. The research at Menzies covers a broad range of disciplines, which really includes many things within child health, global health, as well as wellbeing and chronic diseases. The reason I was inspired to apply for this award is because I'm passionate about growing the next generations of the biomedical workforce in regional and remote Australia.
My vision for the centre would be to have an environment where we're training the next biomedical graduates from high school through to university and onwards. It would be based here. We're training people locally, and their careers would also be in the Northern Territory.
The team consists of Mark Mayo, who leads the Melioidosis Research Unit, as well as Dr. Calinda Griffiths, who is a data scientist focusing on cancer epidemiology, and Dr. Robin Marsh, who really focuses on microbial interactions and in infectious diseases. Having
graduates from the centre being able to go back to their community and ask questions about child health, rheumatic heart disease, working towards getting the community to ask the questions, and then it's community-driven research is what we're looking to work towards, and the more of the community-driven research we have, the better.
Some of the areas that our industry-ready graduates are going to be able to come out and tackle are areas such as suicide prevention, as well as lung disease, smoking, type 2 diabetes, and a whole range of disciplines that are really impacting our population here in Northern Australia.
The graduates from the centre will also have the opportunity to not just work in Australia and Northern Territory, they can work in international locations overseas on diseases such as TB, malaria, melioidosis, which we have here. Adding to that, for me, being a former trainee of Menzies, myself, having these young people come through, it gives me enthusiasm again for the next generation of researchers that we can create. My hope is that in the next 5 to 10 years we're going to have this wonderful set of alumni from the centre who will be able to work to help us to grow this even further. And we really want this centre to be able to be sustainable, and we need to expand it to other areas, remote and regional areas of Australia.